everyone. My name is Ariana Bernal, and today I am going to be giving my persuasive speech. The topic that I chose to discuss today is vaccination. Should you or should you not vaccinate your children? Is it safe? I have created some pamphlets for my audience to follow along with my speech that go into further detail of my points. So, I've actually done multiple essays on the topic and am very well informed on it. I have done a lot of research of many credible sources that I look forward to sharing with you guys. So before we get started, we should know, what is a vaccine? So, according to the Centers for Disease Control and Prevention, also known as the CDC, so vaccines prevent diseases that can be dangerous or even deadly. Vaccines greatly reduce the risk of infection by working with the body's natural defenses to safely develop immunity to these diseases. So, how does a vaccine work? There are 5 different kinds of vaccines. There are live attenuated vaccines, inactivated vaccines, toxoid vaccines, subunit vaccines, and conjugate vaccines. So your most common vaccine is actually your live attenuated vaccine, your MMR vaccine, also known as measles, mumps, and rubella vaccine. So your live attenuated vaccines are where they inject a dead or weakened strain of the virus into your blood so your body knows how to fight it off if it ever comes into contact with it again. So, why are people hesitant to vaccinate their children? So, most people, what they fall back on whenever it comes to not vaccinating their children is vaccines are actually linked to autism. This was a study done by British brain surgeon Dr. Andrew Wakefield. It was an article that was published in the prestigious medical journal known as The Lancet in 1997. This linked vaccinations and an increased diagnosis of autism in British children. This was according to Vaccine Myths Debunked, paragraph 4. Dr. Wakefield spoke specifically of the MMR vaccine. According to the Canadian Medical Association, also known as the CMA, this study caused tens of thousands of parents to refuse to vaccinate their children. The CMA also stated that 12 years after publication, that this was completely discredited and retracted from the Lancet altogether. Not only was the article retracted, but Dr. Wakefield was actually disbarred as a medical professional and lost his license to practice medicine. According to publichealth.org, the paper has since been completely discredited due to serious procedural errors and undisclosed financial conflicts of interest and ethical violations. So there are 7 other misconceptions as to why you should not vaccinate your children. Infant immune systems cannot handle vaccines, which you have to be 6 months old in order for your immune system to be strong enough to handle a vaccine. Natural immunity is better than vaccine-acquired immunity. Vaccines contain unsafe toxins. Better hygiene and sanitation are actually responsible for decreased infections rather than vaccines. Vaccines are not worth the risk, and vaccines can infect my child with a disease that it is trying to prevent. Also, I do not need to vaccinate my children because the infection rates are already so low in the United States. In the publichealth.org article, it also, after each of these points, discusses why these are incorrect and why you should vaccinate your kids. So, the immunization rates everywhere are falling, and vaccines save 5 lives every minute, which is actually a low estimate of the World Health Organization. So there was an outbreak of vaccine preventable diseases. According to the World Health Organization, in the first 3 months of 2019, the vaccine preventable diseases actually quadrupled compared to the first 3 months of 2018. So here I have a video that is kind of backing everything up that I said on why it is safe to vaccinate your children.
Hi, I'm Dr. Howard Zucker, New York State's Health Commissioner and a pediatrician. I want to talk to you about an aggressive anti-vaccine movement that's causing confusion and fear. It's leading some parents to delay or even avoid vaccinating their children. Unfortunately, it's one reason we're seeing more and more reports of these diseases here in New York and across the nation. I assure you, vaccines are safe and effective. I'm a father. My kids are vaccinated. If you have concerns, please talk to your healthcare provider.
All right. So did you know that vaccine hesitancy was actually listed as one of the top 10 threats to global health in 2019? So, vaccine hesitancy leads to not only physical risks, but actually it also leads to bullying and discrimination. So, children who are not vaccinated are often bullied or discriminated against for putting children who are too young to be vaccinated at involuntary risk. There's also widespread media coverage on the topic, and obviously that is very opinionated. And whenever children are unvaccinated, they are actually a lot more likely to not be able to attend school and things like that, so they become more antisocial. All right, so in conclusion, you should all vaccinate your children as soon as it is safe to do so whenever they are at a proper age in order to ensure their health and the health of people around them. Thank you guys.